Welcome to the Refusion Podcast, where we transform patient care.
Welcome to another episode of the RepGen Podcast, where we take an in-depth look into the world of healthcare, focusing on what truly matters, the patient experience. In this episode, we're diving deep into one of the most important topics in healthcare, patient satisfaction. Now, we all know that patient satisfaction is a buzzword in healthcare, but what does it actually mean, and how is it measured? Why is it so crucial for the future of healthcare and the relationship between patients and providers? Well, in today's episode, we'll answer all these questions and more. We've done a comprehensive analysis of what drives patient satisfaction across the top 10 specialties in U.S. healthcare, based on millions of online reviews from real patients. Whether you're a healthcare provider, a patient yourself, or just someone curious about how satisfaction is shaping the way we experience healthcare, this episode is for you. Stick around because we've got tons of valuable insights to share.
Absolutely. Patient satisfaction isn't just about giving patients a positive experience. It's about the long-term impact it has on a healthcare provider's reputation, clinical outcomes, and even hospital ratings. When patients are satisfied with their care, they are more likely to return, recommend the service to others, and stick with their healthcare provider for the long haul. On the flip side, when dissatisfaction sets in, it can lead to poor patient retention, negative reviews, and even a drop in clinical outcomes. But here's the thing. Patient satisfaction goes far beyond just medical expertise. While medical care is absolutely critical, there are other invisible factors that play a huge role in the patient experience. We're talking about wait times, the clarity of billing, front desk interactions, staff communication, and patient comfort. These are all integral to the overall experience, and we're going to dive into how these elements influence satisfaction in often ways you might not expect.
Exactly. To get a clear and actionable view of these factors, we aggregated over 3.2 million reviews from a range of online review platforms, including Google, Yelp, Facebook, and Healthgrades, to name just a few. These reviews spanned from January 2020 to March 2025, ensuring we have a diverse and recent dataset that reflects current patient experiences. We didn't just look at the raw data of how many reviews each specialty received, because, let's face it, raw volume alone can be misleading. That's where our second metric comes in, standardized or weighted reviews. You see, some specialties have a larger number of providers or locations, which can lead to more reviews, but that doesn't always mean they are delivering better care. So we adjusted the data by weighting reviews according to the number of providers and locations in each specialty. This gave us a much fairer comparison across the board, ensuring that we could accurately assess patient satisfaction on a level playing field.
Now, let's look at the raw review trends, and trust me, these numbers tell an interesting story. Orthopedics led the pack with the highest volume of reviews, over 877,000. That's more than 21% of all the reviews we analyzed across all specialties, so it's clear that orthopedics is a popular specialty for patients to review. But just because orthopedics has the highest number of reviews doesn't necessarily mean it's doing everything right. In fact, despite this high volume, it still faced some challenges in terms of patient satisfaction, particularly when it comes to consistency across providers. On the other hand, urgent care came in second with 618,000 reviews. But here's the kicker. Urgent care had a significantly higher negative review rate of nearly 20%. That's pretty concerning when you think about how important urgent care is for immediate, accessible treatment. A lot of that negative feedback focused on long wait times, poor front desk interactions, and unclear communication about the status of care. Now let's contrast that with dentistry, dermatology, and ophthalmology, which had much higher patient satisfaction rates overall. These specialties showed fewer negative comments and generally received glowing feedback, especially in the terms of professionalism and communication of their staff. This shows us that while volume is important, it's not always an indicator of quality. Consistency is the name of the game.
Right. So after adjusting for provider and location differences using the weighted review method, the picture becomes a lot clearer. Urgent care, despite its relatively high volume of reviews, still leads in terms of overall satisfaction when we consider the quality of those reviews. It ranks high on patient sentiment, especially in larger centers that have a more structured and efficient process. But even here, issues with wait times and front desk communication show up, particularly in smaller locations with fewer resources. Looking at specialties like dentistry and dermatology, which typically have smaller review volumes, we noticed something interesting. These specialties showed much more consistent satisfaction across their networks. So even though they might have fewer reviews, patients in these specialties are generally more satisfied across the board. This tells us that quality and consistency of care matter more than sheer volume of reviews.
Now let's really break down what's driving these satisfaction levels. We dove into several aspects of patient care and analyzed which factors had the biggest impact. Here's what we found. Doctor interactions. Across the board, doctors scored highly. In fact, orthopedics led with an impressive 4.7 out of 5. Patients value their interactions with doctors and are generally pleased when they feel listened to and cared for. Practice and office management. This is where we saw some issues. While urgent care performed relatively well, specialties like OB/GYN and family medicine received much lower scores, especially for the administrative side. Scheduling problems, unclear communication from office staff, and unorganized systems were recurring themes in the feedback. When patients are dealing with chronic health issues, the last thing they want is to be stressed out by office inefficiencies. Nurses. Surgery and urgent care led the way here, but specialties like dentistry faced some challenges. Patients in dental offices rated the nursing staff and overall care lower than in other specialties. In dentistry, there's a noticeable gap in care consistency, so continuous staff training could help close that gap. Wait times. OB/GYN and family medicine were the top offenders here, with long waits and patients feeling like their time wasn't being respected. As you can imagine, waiting for long periods when you're not feeling well can quickly sour the entire visit. Billing transparency. Billing issues were consistent across the board, but were especially notable in dermatology and primary care. Patients frequently cited confusion about what they were being charged for, what was covered by insurance, and what wasn't. Simplifying the billing process, providing clear upfront estimates, and following up with patients after their visits can drastically improve the patient experience.
Here's the bottom line. Healthcare providers looking to boost patient satisfaction should pay attention to the following areas. Address administrative issues. Improve wait times, billing transparency, and front desk service. These things are critical in creating a smoother, less stressful experience for patients. Specialties like primary care, OB/GYN, and family medicine stand to benefit the most from these improvements. In standardized service, specialties with high volumes like orthopedics should focus on standardizing their service across all locations. That way, patients know what to expect regardless of which office they visit. Invest in staff training. Nurses and front desk staff are often the first point of contact for patients, and how they interact with patients can make or break the overall experience. Training your staff continuously will not only improve ratings, but also reduce dissatisfaction. This is especially important in dentistry.
Improve billing clarity. Provide upfront estimates and ensure that patients have a clear understanding of their charges before and after their visits. This is crucial in specialties like dermatology and primary care, where billing confusion can lead to a lot of negative feedback. Optimize scheduling. Smarter scheduling tools, real-time updates, and digital check-ins can drastically reduce wait times, especially in high-traffic specialties like urgent care and OB/GYN.
In conclusion, strong clinical care is only part of the equation. The entire patient experience matters, from the moment they walk through the door to their interaction with the front desk to how easily they can understand their bills. Specialties like orthopedics, surgery, and dermatology have managed to create a winning combination of excellent care and smooth operational processes. These specialties are setting the bar for patient experience. Providers, it's time to focus on every aspect of the patient journey. For patients, be mindful of the factors that influence your overall experience when choosing a healthcare provider. It's about looking at the big picture.
Exactly. So whether you're a provider looking to improve your practice, a patient yourself, or just someone curious about how satisfaction is shaping the way we experience healthcare, this episode is for you. Thank you for joining us today on the RepGen podcast. We'll be back next time with even more trends, tips, and strategies to help improve healthcare. Until then, take care and remember, your experience matters.
Thanks for listening to the RepGen podcast, your path to better healthcare.